Welcome everyone to day 3 of our 2020 virtual PWS Family Conference presented by Levo Therapeutics. Before we begin today's presentation, let's first thank our amazing sponsors, Levo Therapeutics, Soleno Therapeutics, Harmony Biosciences, Rhythm Pharmaceuticals, Saniona, and Novo Nordisk. Their support has allowed us to make this conference free to all of our community members, and we are incredibly grateful for their contributions. Let's review a few housekeeping details before we get started so that you know how to make the most of today's presentation. At any time during the webinar, you are welcome to send your questions to our presenters through the Q&A panel located in your Zoom control panel. We will review the questions and answer as many of them as possible during our Q&A session, which will be at the end of the presentation. We will be recording this webinar and we'll share the link after the event, likely in early November. We have several sessions remaining this week. Session attendance is limited, so please make note of the days and the times for those sessions that you wish to attend and make sure to register in advance. All sessions, with the exception of our Connect sessions, will be recorded and made available in early November. Ongoing this week is FPWR's Inspiring Action Video Contest. Members from the PWS community have submitted videos to our contest, and awards will be given to the popular choice, the blockbuster video, and the FPWR favorite. We invite you to take part in selecting the winners by voting for your favorites as we spread awareness and raise funds for PWS research. Please go to fpwr.org and visit our video contest to vote today. In today's session, Social Skills and Cognition Challenges, we'll be having a lively fireside chat amongst experts in the behavior and social cognition fields. Before we get started, however, we'd like to get to know our audience just a little bit better, so let's take a quick poll. You should see on your screen a window has just opened. This window contains 2 questions. First, what is the age of your loved one with PWS? Secondly, does your child with PWS have a dual diagnosis of autism spectrum disorder? There's 3 options for this question. Yes, we have a dual diagnosis. No, but we are exploring a dual diagnosis. And no, we're not concerned about autism. We're going to take just a few more seconds to allow our audience to complete their responses, and then we'll go ahead and we'll introduce our speakers. All right. So I'm going to go ahead and share the results. Not everyone on the call today was able to participate, but you can see that we have about 32% of people attending today are at the 0 to 5 years range. 27% are at 6 to 10. 20% are 11 to 20 years old, and 16% are 21 to 30. As it regards to a dual diagnosis with autism, about 11% of our attendees have a dual diagnosis, 17% are exploring a dual diagnosis, and 71% do not have a concern at this time about autism. Okay, I've gone ahead and closed up that poll. Without further ado, I'd like to introduce Lauren Schwartz-Roth to our audience today. Lauren will be moderating this session. Lauren?
Welcome, everybody. It's nice to see so many people, or at least know about so many people here. Today, we're going to have a research-focused discussion regarding what we know about social skills and social cognition challenges in Prader-Willi syndrome, and what we can do to address these issues so our kids can be more successful. And for those of you who don't know me, I'm Lauren Schwartz-Roth, as Susan said. I'm a clinical psychologist at the University of Washington and also part of the FPWR research team. I focus on overseeing the behavior and mental health research programs at FPWR, and I'm also mom to a 21-year-old young lady with Prader-Willi syndrome. Next slide, please. So before I introduce our panel, I just want to give you a little roadmap for our session today. We're going to start out with a summary of the social skills challenges and some of the latest research findings will be discussed by our panelists. Then we'll have a few questions for the panel, and then we'll open it up for Q&A from the audience. And as Susan mentioned, you can put your questions in the Q&A section on Zoom. Next slide, please. We're really excited to have a great panel of researchers today with us. So I will just introduce them a little bit. They have many more accomplishments than this, but these are some of the highlights. So Anastasia D Metropolis is the director at the Schubert Center for Child Studies and associate professor of psychology at Case Western Reserve University. Her work focuses on understanding characteristics of individuals with Prader-Willi syndrome, including hyperphagia, compulsive behavior, and social and communication issues in PWS. Today, she's going to talk about her recent research evaluating a play-based remote intervention, also called Pretend program for some of you familiar with this, for young children with Prader-Willi syndrome. Louise Gallagher is joining us all the way from Dublin, so we appreciate her being here. It's evening for her. She is professor of child and adolescent psychology at Trinity College in Dublin, and her work focuses on rare neurodevelopmental syndromes and mental health. She's working on a research grant that was recently funded by FPWR focused on influences of social cognition and reward on behavior in PWS. And finally, last but not least, Elizabeth Roof, who some of you may have already heard speak at this conference, is a senior research specialist and PWS research lab director at Vanderbilt University. She specializes in psychiatric and behavioral development and has worked with over 300 families who have Prader-Willi syndrome. She has worked on several different research studies, including most recently the PWS Building Our Social Skills, or BOSS research program. Next slide, please. So before our panelists speak, I just want to give a little brief overview of some of the social challenges in PWS. So PWS, people with Prader-Willi syndrome tend to be very social, even those who might have some autistic features. And most individuals with PWS really want to make and maintain friendships. By the way, this is a slide of my daughter and her friend doing karaoke at her birthday party last year, when we used to be able to have birthday parties. And she really enjoys hanging out and spending time with her friends. Next slide, please. So even though people with Prader-Willi syndrome really do want to connect socially, they can really struggle with a variety of challenges. So one of the challenges that they struggle with is back and forth or reciprocal communication. You may have noticed that sometimes people with Prader-Willi syndrome just want to talk about the one thing that they're interested in a bit of a monologue, which can be hard to connect with others and develop and maintain friendships if you do this. Also, they can struggle with recognizing emotions in others. And for those of you who've been in the conference the last few days, you may have heard more about this. They have particular difficulty recognizing emotion in faces. Recent research has shown that there are really significant challenges with understanding what people are feeling by looking at their face. And this can really lead to some struggles, as you can guess, with interpreting social cues. We think that people with Prader-Willi syndrome probably have a difference in the way they process incoming information, which then impacts their understanding of social cues from others. We know that they also have a harder time learning through watching others. And often this is how typically developing people learn social skills, by watching others. So this can make it really difficult. People with Prader-Willi can struggle with being aware of personal space issues. They may have a habit of kind of invading other people's space bubbles, kind of standing too close. And finally, they can have a delayed development of theory of mind. They can learn this concept, but it takes them longer and much more repetition. And theory of mind is really important for understanding that other people may have different beliefs, desires, intentions, and perspectives that are different from their own. I think Elizabeth Roof spoke yesterday about a child she was working with whose favorite color was orange, and he had a hard time believing that other people might have a different favorite color than he did. So this is something that we need to work on with our children to help them understand that. So people with Prader-Willi syndrome do struggle with social connection, but are also generally motivated to improve things given their strong desire to have friends. So we can use this. We can use this motivation to help them make changes. And we know that in the general population, having good social connections and friendships is a strong predictor of overall well-being. And this is likely true for our loved ones with Prader-Willi as well. This is why this area is so important for us to study and understand, and one of the reasons why we wanted to do this panel discussion today. So with that brief summary, I'm going to pass it over to our panel, who will talk more specifically about their research in this area and how it has the potential to advance our understanding of the social challenges in Prader-Willi syndrome, and hopefully highlight some important areas for intervention. So next will be Anastasia D Metropolis.
Hi, everyone. Thank you, Lauren and Susan, for inviting me to be part of this conversation today. I'm honored to be here with Elizabeth and Louise. I wanted to start off by just telling you all a little bit about update on our Pretend program. For those of you who know, we have been evaluating the use of a play intervention for school age and preschool age children for the last several years in my lab. So we just want to give you a couple updates on that work. Next slide, please. And so most of you have heard myself or someone from my group talk about the importance of play and talk about the importance of pretend play. So I will not belabor that. I will just, make sure everybody's on the same page that better play skills or creative play are linked in the typically developing population with increases in cognitive and behavioral and social development. So something as easy as learning how to have more rich and qualitatively advanced play may lead to skills in other things, and that's what we're interested in. We also know that play-based intervention in autism and in other atypical populations, which is widely used, have been shown to improve outcomes and decrease problem behavior. And so we set out to see if we can use play intervention in preschool children and in school-age children with Prader-Willi syndrome in order to boost play skills and optimize that play environment, and also work on challenging behaviors that the child may be having. And so many of you know we've been doing this work remotely. So we've done this prior to the pandemic. And so now you probably know that we first set out to identify whether this is feasible. And certainly, as you've seen in the last 7 months, we can do many things on Zoom, including direct intervention with children and parent training. More importantly, we're interested in understanding how this leads to gains in play skills for children and in other behavior long-term. Next slide, please. So our program, the Pretend program, stands for Play-Based Remote Enrichment to Enhance Development. It's a 8-week intervention program, either parent training based, which I'll talk about today, or direct intervention with school-age children. So for our parent training, preschoolers between the ages of 3 and 5 are, their parents are enrolled in the intervention. And so we use this intervention opportunity to boost play skills and work on challenging behaviors. Next slide, please. So just to orient you to this slide a little bit, so we wanted to show you just some brief updates on our preschool sample. And so 18 children have enrolled in our second wave of data collection. Not important other than to know that this is a small sample size, and so we take our findings with caution. They were either randomized, parents were either randomized to the intervention or the waitlist control group. And the way to interpret this slide is that the percentage indicates how many children improved after parent training on play skills. So there are a variety of things we look at in terms of play, the complexity of play, how much affect is used. And so if you look at this slide, I'd like you to orient to the dark orange columns. What we found is when we originally looked at just intervention versus waitlist, we saw that there was something else possibly going on. And so we looked at the data by genetic subtype. So if you just visually scroll down the dark orange columns for our intervention groups, you'll see that our kids with maternal uniparental disomy are showing increased quality of play after parent training than our kids with deletion. And this happened over the waitlist control for both subtypes as well. Next slide, please. So just to call out some of these findings, one of the things we're interested in is how much affect the child uses during play, whether they're saying the affect or making an action that would be indicative of affect. So for example, two bears hugging or saying, yay, this game is really fun. And so the way to interpret this graph is each group has a different color line. So pay particular attention to the blue line and the green line. Our kids with UPD in the intervention group showed significant gains after parent training than the other three groups, excuse me. Next slide, please. We're also interested in the complexity of the play. So symbolic play is refers to play that's used when toys are used in an as-if manner. So for example, using a banana as a telephone or using a block as a rocket ship and creating a storyline related to that. And so what we see again is our blue line, our kids with maternal UPD are showing greater gains after the parent training than the other groups. Next slide, please. Along with that, if symbolic play is going up, then functional play goes down. And so functional play is a little bit less rich in complexity, and we see that in younger children. And what we've seen in this sample is that the percentage of time spent in functional play is tagged or related to how much time is spent in symbolic play. So if you have more symbolic play, you have less time for functional play. And this is what we're seeing here for our kids with maternal UPD. Next slide, please. And so our plan of action moving forward is to continue to look at efficacy and develop an implementation plan for our findings. And so one of the things we're clearly interested in, and you all may be as well, is why are we seeing differences in among the genetic subtypes in terms of response to intervention. In this small sample, what we realized is that our kids with deletion status, parents are reporting them to have more challenging behaviors at this preschool age than our UPD sample. We do have data from other studies that indicate that kids with UPD have greater challenges with social problems, but in this particular sample, the opposite is true. And so we think what may be happening is, regardless of genetic subtype, it may be that challenging behavior is either interfering with the child's ability to engage and learn in this setting, or with the parent's ability to have the space to work with their child in this. And so we're continuing to look at this. Our findings from parenting stress in some of our other work would indicate this to be the case, that the higher parenting stress, the harder it is to work on some of these issues. We continue to want to identify if play intervention can generalize to general social cognitive gains in everyday life. That's our goal here. Our goal necessarily is not to make people better players, but to see if that play then relates to other types of functioning and how it can be extended in the home and in the classroom environment. We're also planning to develop an implementation plan. So training intervention, we're a small group at Case Western. So our goal is to examine the fidelity of our intervention and train other people to be able to do the parent training and the child intervention moving forward. Our findings from our school age participants, which I don't have here, just to remind you all, indicate that direct intervention is also showing increases in these qualitative play skills, and that relates to cognitive flexibility and thinking outside the box a little bit more. Next slide, please. So I just want to highlight that we are still recruiting for our school age sample. This is direct play intervention via Zoom, and one of the barriers to participation that used to exist before the pandemic is now gone. All participation is done remotely, so we no longer need to see kids in person either both before and after the intervention. So anyone across the United States and Canada can participate in our studies. So please reach out to us if you're interested in having your child participate. Thanks.
Thank you, Anastasia. Could you mention the ages for the school age project?
6 to 9 years of age.
Okay, great, thank you. I know there probably will be people interested in participating, and those are really exciting results, and we are looking forward to seeing all the next steps you talked about. Thank you.
Thanks, Lauren.
So our next speaker will be Louise Gallagher, talking about her work in autism and in PWS.
Thank you, Lauren. So first of all, I'd like to thank Lauren and Susan and the team at FPWR for the invitation to speak, and I'm very much delighted to be here speaking together with Anastasia and Elizabeth today. Next slide, please. So I just wanted to go sorry, it's animated, Susan, so if you keep clicking. I just wanted to go back and tell you a little bit about an evaluation of the needs of people with PWS that we did in Ireland, where we found that a key behavioural concern that parents reported were included repetitive questioning, difficulty transitioning and non-compliance in their children and young people. And these are concerns that are very common also in autism spectrum disorders. Next slide, please. You might need to click twice because there's an animation. Yeah, thank you. And if you just click, yeah. So, so this led us to ask the question: are there common characteristics in PWS and ASD? And I have to say that I started out life very much more as an autism researcher. So I'm coming to PWS through the lens of autism research. So we asked, are there common characteristics in PWS and ASD, and there's some evidence for why this might be the case, including shared genetic risks. So the PWS region harbours autism risk genes. There are behavioural overlaps that we've already heard a little bit about, and there's evidence that autism symptoms and diagnosis is increased in PWS over the course of childhood. Next slide, please. So this led us to ask the question whether or not there are differences cognitively in people with PWS who've got autism traits. And particularly we were focused on social cognition. So as we've learned, social cognition is the ability to perceive and understand the thoughts and feelings of others, and this relates to recognizing emotion, body language and theory of mind, and we see that it is atypical in the context of autism, and also that there's evidence for atypical social cognition in the context of PWS. Next slide, please. So it led us to ask the question, as we know that social cognition is impaired in autism and is very much related to the some of the atypical social behaviours that we observe. We wanted to ask the question whether social cognition is impaired in PWS, and is it related to autism symptoms, and whether social cognition increases certain behaviours such as oppositional behaviours and reduces social functioning. And we had a third question, which was to do with reward in the brain. So the process, which I'm going to talk a little bit more about because it relates to the core feature of hyperphagia in PWS. Next slide, please. So I'm really just going to tell you about the project because it's ongoing at the moment. I don't have any results to present really to you today on this subject, but our research approach involves using eye tracking to study social cognition. So eye tracking is a technology, very simple technology you can mount on a computer, where you can track the eye movements of people when you're showing them images or videos. And we use it we show social images and videos and use it to see where the person's looking. And we know that autistic children process social images differently. And so we aim to look at this in PWS and relate their eye tracking behaviours to underlying autism symptoms and behaviours that we measure with questionnaires. Then we will relate these eye tracking data to the reported difficulties with rigid or oppositional behaviours or their social adaptive functioning. So we know that social cognition can play a role in these behaviours. So if you don't understand, for example, other people's perspectives, you may not be too bothered having a tantrum in public. And we also know from autism that social behaviour is very closely linked to adaptive functioning. So we want to explore the relationship in PWS. And then we wanted to turn to the curious question of why might autism symptoms emerge over time in PWS individuals, which is different to autism where the symptoms are more evident earlier. So there's one study that shows that they emerge a little later in PWS. And we thought perhaps people with PWS are not interested in social interaction because the part of the brain that responds to reward is more interested in food cues. And we use eye tracking and brain EEG, so looking at the brain waves, to measure the value of food and relate them to social behavior and autism traits. And then finally, because we're involved in a large autism consortium, we're involved in studies that look at how autism traits and symptoms change over time to help develop biomarkers. And we've used similar measures in this study in the PWS group, so we can compare our results with the autism data to see are the social cognition or social behavior differences in PWS the same or different to autism. And we think it might help us to answer some questions about the nature of the difficulties in PWS and maybe help to guide us on how maybe to provide best interventions. You know, should they be autism specific or PWS specific, or does that vary by individual? Next slide, please. So you might need to click through, Susan, apologies. So this slide just illustrates some of the tasks that we use. So on the right of the slide, you see 3 social cognition tasks. One is biological motion, where the person sees little moving clips of dots that are either lifelike or scrambled, and we compare how long a person looks at each type, because we know that typically developing people might look at things that look more like a human or a dog or more lifelike. And the opposite may be true in relation to autism symptoms. The next is the one in the middle shows a different face emotion processing task. So we look at how the person looks at the face, and we know that autistic people might look at the edge of the face rather than the eyes and the mouth. And the final one is a theory of mind task, which is a very well-known perspective taking task involving puppets, where one hides something on the other, and then the child has to say what the other thinks about where the object is hidden. So next slide, please. So just the overall goals of our research are to answer some questions about autism traits in PWS, and are the traits related to similar deficits in social cognition that you see in autism? If yes, are some of the interventions in autism, could they be adapted for PWS? Or if the issue is more strongly related to hyperphagia and rewards, then maybe targeting hyperphagia might be a better approach. And finally, we think that if we have good measures of these traits and symptoms, they might be useful as biomarkers in the context of clinical trials, because I know that many new drugs in PWS may target behaviors as well as hyperphagia. And the problem is that when we use questionnaires, we don't always get consistent responses. So it can be hard to judge when a therapy is really effective. So we think that having more independent measures of behavior could be more benefit for evaluating drug therapy. Next slide, please. So I'm just going to finish there. And if you click again, Susan, I just want to highlight Sarah Marie Fian and Kira Malloy, who are the PhD student and the postdoc working on the project. And thank you to FPWR for funding this project.
Thank you, Louise. That was a great talk. Very interesting. I think this idea of kind of the role of hyperphagia and social challenges is a very interesting one that hasn't been explored that much. So we look forward to seeing that. Before we start with Elizabeth, I think we're going to do another quick poll question. So I'm going to pass it over to Susan for that.
Thanks, Lauren. I am just working on getting that up. It's going to take just a second. Here we go. All right, so in the next presentation, Elizabeth Roof will be talking a little bit about social skills. So we wanted to hear from you all whether your loved one has participated in a structured social skills group or other treatment focused on social skills. And if you did, was it helpful? Was it not helpful? So we'll just take about 20 seconds to collect our poll responses. And just as a reminder, if you have questions, please enter them into the Q&A. We will be having time at the end of today's session to answer all of your questions. So it looks like we've gotten a number of our responses. About 65% of you have voted, and these are the results. 26% of you have participated in a structured social skills group and found it helpful. About 6% also participated but did not find it helpful. And the majority of us, 68%, have not yet participated in structured social groups. So with that, Elizabeth, we're going to let you go ahead and take the reins.
Awesome. I'd like to also thank FPWR for the invite and being able to talk about, I think, a really important subject with Anastasia and Louise. And what I want to talk a little bit about, because I actually wrote down several things that they said that I think that I'll actually be talking about as well, this idea of what we know about social skills in PWS, and some of the kinds of things about like psychiatric and other behavioral features, which may interfere with the ability to learn social skills and the ability to really carry them out effectively. So I'm at Vanderbilt University, and we actually got funding from FPWR to do a really cool virtual study long before COVID in 2017 to actually look at people with PWS and social skills and kind of what we know. So I'll be talking about some of those results, but also talking about what we know about social cognition and social skills in PWS. Next slide. So how we know this, basically we've been studying PWS for more than 25 years. Elizabeth Dykins, who was at Yale and at UCLA and then now at Vanderbilt for almost 17 years, and I have both been studying PWS and are very interested in it. We follow more than 320 people with PWS through adulthood. We also focus on the strengths. So this idea of, you know, only figuring out what people are not good at, to me, is not very helpful for families. They hear that all the time. Every time they do a school evaluation, or somebody, you know, basically says, well, your kid's not good at this, or they're not whatever. Parents know that, but they do have some real strengths that we need to talk about. And so we want to look at more the whole picture of people with PWS and not just the weaknesses. So can we use the strengths to mitigate some of the weaknesses? And some of the strengths that we know is they can be incredibly nurturing and kind and loving. They love, a lot of them love animals, younger children, babies. We see a lot of real kindness there. And we also know that, you know, even that social motivation is a real strength. They are interested in other people. They are very interested in connecting and making friendships and keeping friendships. What they lack, we found, is the skills. And so this idea is we can use the strengths to actually mitigate some of those weaknesses. We focus specifically on the behavioral, social, and emotional characteristics of PWS. So whereas other people are very interested in things like, you know, weight and obesity and diabetes, we're really interested in more the kinds of what people often call soft sciences, but to me, what the things that actually kind of make the biggest impact in quality of life, right? So you can be overweight and still have a great quality of life. But this idea for most of our folks is right now, especially during a pandemic, we're really somehow struggling to make those connections, to keep those connections, and trying to find different kind of modalities in order to actually make those connections. We spend a lot of time with parents and kids with PWS. So each visit, people come every couple of years. We spend 6 to 8 hours. I spend a lot of time with the parents, and then I spend usually an hour or two with the kid. And we also follow each person over time and have 4 to sometimes 16 visits for some of our folks over 25 years. So for a fair number of our folks, we basically watched them grow up. So they were, you know, early childhood or teenagers. And now I have somebody who I saw the first time when they were 16, and now they just turned 40. So the idea is that we're seeing people and seeing how they grow and develop and change. And I think it's really important to know that people do change over lifespan. They continue to develop new skills and get new skills. So we don't want to look at them as a stagnant kind of thing, but it's ever changing. And if we can intervene at the right time with the right interventions, maybe we can actually kind of change the trajectory of social skills and social kind of connectedness. We also focus on developmentally appropriate behavior. So this idea of, for a lot of our folks, you know, they talk a lot about, you know, we have people who ask a lot about, you know, is this just hormones or is this just whatever? Well, developmentally, we know that they may be a little bit behind the curve. So the reality is what we know behaviorally, a lot of the behavior problems emerge a little bit later for some folks. and they continue all the way through the 20s, which I call kind of the Pws teenage years, where they fight for independence, they fight for their own opinion, they fight about almost anything. But the idea is that's that kind of individuation period for people with PWS, wanting to be independent, wanting to make their own choices. And that's a great time to connect them with some of these social skills, because, you know, parents are like, well, I've been everything for my kid. Well, great, but you're still their parent. So it's important to kind of know that most kids and adults with PWS want peers, not family and parents. And I think because we're not in a hospital or a clinic setting, we get more naturalistic results. We also often do pretty detailed ADOSs, which are, you know, basically kind of a diagnostic for autism. We also do spend time playing with kids and kind of finding out what their interests are. So it's really cool to see what they're like and how we can take those skills and then generalize them into their kind of real surroundings at home and at school. Next slide. So what we know that many kids with PWS are socially motivated. They want to connect with others. They want friends and relationships, but they may have a harder time learning through watching other social interactions. So we often learn other people's crash and burns moments, go, oh, well, I don't want to do that. That was a disaster. People with PWS don't do so good at that. They're not great at doing that. What we think is there's just too much information, too many things you have to notice all at the same time. They're so busy focused on this thing, they forget this thing, and it's very important. So we need to kind of help them focus their attention on the right things, the most salient things. They often need concrete rules and supports across all settings. So the idea is they really do need rules to kind of govern things. We had a young man who was texting a young lady at his school, and her dad called the boy's mother and said, hey, your kid is, you know, harassing my daughter. And so we were talking about the idea that he thought he was trying really hard to connect with her and that she really liked him. She, of course, told her dad, this boy's bothering me. And so what I said is, I go, women like a little mystery, you know, text her once a day. And I said, if she doesn't text back, cool. And if she does, awesome. But the next day you can kind of clean the slate, but you don't need to text her 37 times a day. That's weird. That's stalkery. They need those kinds of concrete rules. And as soon as I said that, things got much better because he had a rule. He could only text her once a day. They need structure. They need activity to anchor social activities. They cannot go on Zoom or any other platform and hang out with their buds without some structure, some rules, and some consequences should they break those rules. They need accountability, and they need norms to help them manage social interaction. So this is okay, this is not okay, and this is why it's okay. They need those kinds of concrete things. They don't necessarily get subtle. So we're generally not subtle. We're pretty direct, and it may seem a little harsh on the outside, but most kids with PWS go, oh, I get what you're saying. But whereas you're subtle, they don't get that. Next slide. So we know that people with PWS have difficulty recognizing emotion. So it's hard for them to know kind of how others are feeling. Sometimes I think it's hard for them to know how they themselves are feeling. And then it's really hard for them to read emotional cues in social context. Again, so much going on, so much to process. Sometimes they get lost, the you know, trees for the forest kind of thing. So they really sometimes struggle about seeing the bigger picture. And sometimes we have to point that out to them. So I think it's important to know these are deficits that occur in childhood and they continue through adulthood. So it's not like people just grow out of them and get better. You have to specifically teach them how to get better. They don't necessarily do that just on their own. Next slide. So we know that they have difficulty recognizing all emotions except for anger. They're really good with emotionally charged events. And you will often find that your kid will, you know, verbatim recite times you were angry, times you've been upset, times you yelled at them, even though it may be incredibly rare. They remember it. They remember what happened. They often remember that you were at fault. It certainly wasn't them. And they really take those emotions. We've had people talk so succinctly about things that happened a long time ago that sometimes it's hard to remember that it happened 10 years ago. It sounds like it just happened yesterday. The amount of energy and detail and, again, emotion they put into it, it's amazing how they hold on to these things. So we have to know that they're really good at anger, but not so good at all the other emotions. Next slide. So knowing their lens is distorted can help us make things clearer for them. So again, learning to focus attention, using things like voice and body cues to enhance communication. We're very animated when we interact with people with PWS. I'm generally pretty animated anyway. It helps them know what we're thinking, what we're feeling, what we're trying to communicate in a way that other people who are maybe a little bit more subtle, a little bit more shut down, sometimes don't communicate that. So again, helping them learn to slow down and soothe themselves before responding in kind. Sometimes if they're upset or you're upset, they just kind of escalate. So we want to help them learn to do some of those things. It's really important to take in all the information before coming to a conclusion. Generally, they jump to a conclusion, they decide a thing, you're mean to them, you're being, really unfair, it's very personal, without kind of sometimes understanding the kind of broader context. And again, so that they don't always respond negatively to situations. That lens may make it harder for people to see things clearly. We need to help them kind of figure out what to focus on and help not make it so distorted. Because when you see the world as a negative, punishing, kind of cruel place, you respond in kind. So our job is to help them kind of see that not everything is about them, directed towards them. And sometimes people make mistakes that have nothing to do with them. So it's this idea of giving them context clues to help them understand social situations. Next slide. So we did the Building Our Social Skills group with the grant through FPWR. It ran for 2 years. It ended in 2019. We saw 60 people. We did this kind of like virtual Zoom long before it was kind of thing that everyone was doing. We were actually doing it and found it to be incredibly effective. And so the idea is that it helped improve social skills. It really decreased kinds of all the maladaptive behaviors, all those kinds of things. And it continued on after the groups were over. And so it was really cool to see kind of how people participated, how they really enjoyed it, and how they found ways to generalize those findings in their normal lives. And many parents talked about the fact that people were able to take those same skills and do them in their own setting. One young man, where we talked about taking a deep breath when you got upset and taking 3 deep breaths, and we would practice it in group before anyone got upset. He said, well, I had a really bad day. He said, I took my 3 deep breaths. I go, and did it help? He goes, no, but I took 3 more, and that time it did. So we were amazed that they were able to kind of take some of these skill sets and find a way to actually use them in a way that made sense and help them with their just daily life. Next slide. So social connection during social distancing. I mean, I think, like I said, it was kind of interesting that we did BOSS virtually so that we had people participate from other countries. And we were able to kind of see that during groups, we found that we could increase social skills. We could decrease problem behaviors. We could increase connections with other folks, and we could lessen psychiatric issues. And one thing that Louise and Anastasia both kind of touched on is this idea that psychiatric and behavioral features may be really making it difficult for people to kind of take advantage of interventions. And what we do know from our research is that those with pretty significant psychiatric features, especially like anxiety and depression, and even psychosis, that keeps people from actually kind of maximizing their social connectedness and skills. So we need to treat those, deal with those things, instead of just kind of going, oh, it'll all work out, because again, it's too much for them to all do at once. So we really need to mitigate those behavioral and psychiatric features so that we can really maximize social skills. After groups, many groups continue to meet without leaders. They did it on their own. Many have made new friends. They're still Zooming together. They, do puzzles. They do all sorts of other stuff. We've had a few pitfalls. I know that some of the folks, we actually had to close down some of our social groups that were running on their own, even though they did great for several months. We had issues with people, arbitrarily kicking people out of the group, asking people to, to kind of go outside of group and form other groups where they ostracized other members. We're now going to actually start working on moderating those groups again on our end. So the lessons learned was they still need structure, they still need consequences, they still need accountability. And as much as we would like to kind of let them go on their own, we find that over time, they tend to get in trouble. So we want to help them continue to have those social connectedness without having the problems of managing on their own. Sometimes people get, with PWS, I know you can't imagine, get a little power hungry, and they kind of enjoy the power that they hold over others. So we have to keep that in check by actually managing and supervising. Next slide. I think that was it, maybe. Perfect. Thanks, everybody.
Thank you, Elizabeth. That was great. My daughter participated in the BOSS groups and really loved it. And like you said, you guys were cool with Zoom before everybody else.
Right.
Trailblazers. So if everybody could turn on their cameras and mics on the panel, because I'm gonna ask a couple questions, and this is our question and answer section. So what would you all kind of talk about different ages and maybe different issues that become significant in the arena of social skills. What would you recommend parents be on the lookout for in terms of social skills challenges that might lead a parent to get an assessment, for ASD symptoms or for something else, or encourage them to start to get involved in some structured intervention? And in particular for different age groups like children, adolescents, and adults. So Anastasia, you want to start since you can talk a little bit about the little ones?
Sure. So, I mean, I think Elizabeth brought up some really good points that span the age range, right? In terms of having difficulty just initiating, right? And so in older ages, it may be initiating a social conversation. In younger ages, it may be just knowing how to interact inside, the family home in terms of how do we play. And so having parents really work on working with their children on terms of how do I engage, how do I initiate that play or whatever the action is that they want to make, right? If they want to engage with a sibling or with the parent, and giving them some structure around that, right? And so modeling is really important at these young ages, right? Teaching the child, here, this is how you do it. Like you said, watching other people do it is not necessarily the best way. So having them engage in the play with the parent would be important there. And certainly in the early ages, and I'm sure Louise can speak to this, if we're looking at a potential diagnosis of autism, then we would be looking for things like not, picking up on cues from the parents, having difficulty imitating, difficulty relating to people in the household. Certainly at those early ages, we would want to look at developmental assessments as soon as possible.
I can remember when I have two kids when they were little. My youngest one is 3 years younger than my daughter with Prader-Willi, and her little sister came up to her when, I don't know how old they were, but they were definitely school age, and said, I have a little mouse in my hand, showing my daughter Emma. There was nothing there. She was pretending. And my daughter looked at her hand, looked at me like, Mom, has she gone insane? There's nothing there. And so we had to say, she's pretending that there's a mouse in her hand and you can pet the mouse. And so Emma was like, oh. And so but we had to sort of talk her through it.
Sure, like practicing those skills, sitting down and just practicing those skills, I think is really important. And just starting, they may not be able to start the story on their own, right? Or start the example. So someone start it for them, right? Hey, we're going to the zoo. Let's see what animals we can see, and start the story and let them take over.
Yeah. Thank you. And anybody else on the panel want to comment on that, kind of what to look for and when to maybe get intervention?
Lauren, I suppose it's also I suppose some of the difficulty sometimes is understanding when social behavior or social skills are age appropriate or developmentally appropriate, so I think it's, and that sometimes can be difficult for parents to call, because they may have no experience of this before. So it's always good to talk to a pediatrician if you're worried about areas of development that you don't think are just typical to PWS. So I think we've heard before that people with PWS want friendships and they want to engage with other people. So I think if your child is having, so there are a couple of things that are more autism specific that people might want to look out for. So we often talk about social communication in autism. So having poor eye contact or poor gesture use and not taking turns in conversation, or not being able to show emotion. So I think that there are often symptoms of autism that may be a little bit, that people might notice are different, maybe if they're involved with other groups of PWS specific groups and they see other children, they might notice differences between their child and maybe the other PWS children. And then I think also as kids get older, maybe, not always having language for emotions, or being able to, or maybe mislabeling emotions in themselves or other people. And of course, I think as Elizabeth, has shown very nicely with her research, that some of that is a little bit, is already present in PWS anyway, but I think if they are really showing a lot of difficulty around that. And then sometimes as well, it's picking up on the inappropriate behaviors and trying to understand, sometimes are these things to do with autism. So Elizabeth was giving an example as well of a young man, a young adult man, or an older teenager contacting somebody via text all the time. It was really quite socially inappropriate. I mean, that's something that I would encounter a lot with autistic patients, as well as people are trying to get older, maybe establish friendships and relationships, just they're out of sync maybe a little bit. So yeah.
Right. I think Louise, the intensity is kind of what's different, right? For typical kids, they go, well, they didn't text me back, I'm done. For people with PWS and with autism as well, they didn't contact me. Maybe they didn't get it. I'm going to keep, it's like a pigeon just pecking at a button. They just can't let it go. And it's like, man, if they're not texting you back, that's an answer in itself, right? They don't get that they're actually responding by not responding. So I think it's important for people to read those more subtle cues, but it often takes somebody pointing it out before they go, oh, okay. Like they may not like it, but they kind of go, oh, okay, that makes sense to me.
I want to just also put out a question about, because a lot of people have had questions about ABA, and that's been talked about in the conference previously. And I think many professionals have different perspectives on that. Some families are getting ABA for their children with Prader-Willi syndrome who have a co-diagnosis of autism spectrum disorder, but some families are also getting ABA even without that diagnosis, just with the Prader-Willi diagnosis. Do you have any thoughts about that, and in particular, what sort of behaviors or things ABA could be helpful with for people with Prader-Willi, or not helpful with? And anybody, it's a free for all. Anybody.
Yeah, and somebody just asked what ABA is. So it's applied behavior analysis. So it's this idea of looking at behavior in kind of a context of what it does, what reinforces it, what triggers it, what things keep it going. So it's a way of breaking down behavior problems so that you can see them not from the reason they did that is their mom was mean to them. Like it's this idea of really taking behavior apart and figuring out what keeps it going, what kinds of things trigger it, so that we can actually intervene at some point. So it's I think, all in all, it can be a really effective thing, regardless of diagnosis of autism or not. But I do think you have to figure out what it can actually fix. So when I deal a lot with ABA therapists and they're focusing on things like hyperphagia or whatever, I'm like, okay, well, that's not going to fix any of those things. Let's focus on what can actually make a difference. So things like compliance, avoidant behavior, initiation, kinds of like structuring and scheduling. I think it's quite good at kind of helping people take things apart and figuring out what is reinforcing it. I had a young man who continued to have issues at school and they kept sending him to the resource officer, and I was like asking some more questions about it, and come to find out he got to sit in the squad car, push the sirens, and hang out with the canine unit. I go, you're reinforcing the very behavior you're hoping to get rid of. So what we did is have the resource officer check in once a week. He'd cruise by the classroom, and if this young man was being great, he would actually take him out and he got to do all those things. But if he was, not being great, he didn't. So they basically turned it around in a way that was way reinforcing of good behavior and not necessarily negative attention-seeking behavior. So it's those kinds of things, really taking things apart.
I would agree. I would just add that ABA is much more than just discrete trial training, right? So we hear about ABA in autism, and we think about, training to a specific action or a specific learning need that we would train over and over again until they master that task. And that's not all of ABA. ABA is much bigger than that, as Elizabeth alluded to. And sometimes it's really important to identify, as she said, what's driving a problematic behavior that may not be as clear as something that happened, immediately surrounding that event, right? It may be something that happened 2 hours ago, or that they're looking forward to in the future and is reinforcing that behavior. So ABA can be a part of many interventions, right? So its principles are used across different types of interventions. I think just discrete trial training is what you're talking about in terms of, intensive therapy on a specific action item. And as Elizabeth was saying, for some things that wouldn't be appropriate, right? We would not use that for anything food related in Prader-Willi syndrome.
It looks like we have a lot of questions coming in the Q&A, so I might just transition over to that as well. And I'm going to let Susan kind of take the reins on that one.
Wonderful. Well, thank you all for all of the information that you've been giving us. As Lauren's mentioned, we do have a lot of questions coming in, and we'll do our best to get through as many as we can. The first question I'd like to present to you all is that of socializing younger children. So in this example, it's a first grader. Do we want to put them in typical social groups to get that social interactions, or are we looking more for specialized social groups with moderation or facilitation?
I think a lot of it depends on the kid themselves. So I would say that identifying where they are developmentally. So do they have some social skills? Do they generally get along with typical kids? And if the answer is yes, I think it's perfectly appropriate to put them in groups with typical kids. But if they're not initiating on their own, if they just kind of stand and watch the group from the edges and that kind of stuff, then no, they're not. They're always going to feel like somebody's jumping rope and they're never able to get in. They're always just watching it go around. So I think it's important to figure out where they are, assess them individually, and then at that point pick the group where they can feel confident and not just watching from the edges.
Mm-hmm. I'll just jump in as a parent. We tried to do both with my daughter. When she was in kindergarten, we had her in a developmental kindergarten that was just a few hours a week in the mornings, and then a couple afternoons we had her in a typical kindergarten program that was smaller, just so she could sort of get that exposure to, we wanted her to see the modeling of typical kids and how they play and interact, but also to be in an environment where she could be supported and learn some of those things.
Mm-hmm. And that was actually the next question that we had, which is, what's the best environment? Is it with typical kids that can model appropriate behavior, or is it in a smaller environment with non-neurotypical children, so that we can have a smaller ratio?
I think it depends on the child. I really do. I mean, I do think it depends on where their skill set is at that time period. And, you may start off in the atypical group to try to work on some specific skills on initiating and conversation skills, and then move them to a typical group.
Mm-hmm. Being flexible too is what I'm hearing, is kind of like what works one year for your kid, the next year. I mean, don't just sort of allow the school or the system to say, well, now this is their program, that each year.
Right. You're not on a train track. Every year you reevaluate what worked, what didn't work, and then at that point pick thing that you think is the most appropriate. And I will say that for a lot of our teens and adults with PWS, because parents are trying so hard, and this sounds like such a weird, to normalize everything so that they never feel like they ever have PWS. Most of our kids actually talk about the fact that by normalizing everything, they never had a peer group. I mean, the nice thing about BOSS is that people would say, oh, everybody has PWS. I'm like, yeah. And they're like, huh. And they really, it resonated in a way that they'd never had. And some of these folks were incredibly high functioning. I love the fact that they finally found their family, the people that knew them and understood them in a way that was kind of unconditional. I think they need that. It's not everything, but it's something.
Right. You think that's really important. And, there's variability in the families that we see on, what the level of comfort is with interaction with other atypical populations versus typical peers. And, you all see when we go to these conferences in person, how much delight and connection kids get from being with people, other people with PWS. So, I think, and I'm bringing it back to the pandemic, but I think the pandemic is allowing us to think outside the box a little bit, and thinking about Elizabeth's work on the BOSS program, and seeing how do we take that and make that a bigger part of life for people with rare disorders, just to give them more interaction than they would be getting in a typical year. I mean, I've heard you know, I've had conversations with people at conferences that says, this person's my best friend. I see them every 2 years. And, you know, to have those connections more frequent, I think is important.
We have a lot of parents on the line today with very young children, toddler age. Do you have any one piece of advice that you can give them so that they can help their children build these social skills now, in the toddler years?
The one thing I would say is play. Get on the floor and play with your children, and pick toys that are not things that you can only do one thing with, right? Use blocks, use dolls, and use animals, and help them more than you would with a typical child, right? So typical children naturally just sort of set off and start playing, and they may need more guidance and support. So start a story stem. If there's something they're struggling with, say there's a sibling that is always late when they leave for school and it affects the entire family, and this child with PWS is really upset by that. Use that environment to play out that scenario. And so even at toddler ages, I would just sit down and start talking, start labeling emotions, start using that emotion labeling in the play. So we do that a lot with our intervention. Start a story stem that's going to be based on an emotion. This little boy lost his toy at the fair. How can we help him find it?
Oftentimes our kids will watch from the sidelines what's happening as other children are playing. They're late to engage. Any suggestions on how we can get our kids engaged with another group of kids?
I think sometimes big groups can be a little overwhelming. So I think that kind of like easing them in, like with a person. I also think it's really good to come up with if they're a little bit older. I'm definitely not the toddler whatever person, but if they're a little bit older, can they come up with things they can say? So can they compliment somebody? Can they ask about a pet? Come up with one or two kind of rote lines that seem to be like great, conversation starters, and basically just kind of let it go. Also just watching and then imitating. So the idea of what, if people are playing a game, how do you ask? You say, can I play your game? And, those things of like, you literally have to coach them on what to say, how to say it, how to interact, because they don't know. I think it's like coming from another planet and going, I'm not really sure what to do here. And I think people often just think they'll figure it out. I think they really need you to support them and try to figure it out in a way that's a lot less threatening. So it's not 8 people, it's you come up to one guy. You look at one kid who smiles at you, that's the kid you approach. You don't do the ones who are avoiding eye contact or ignoring you. You don't come up to those guys.
As our kids get older, adolescents, early teens, we find that the neurotypical kids grow away from them, right? They mature faster. So what can we do to help our kids maintain friendships during those years when perhaps building friendships is going to be very challenging?
I think that's the very time, like I said, that you make sure that they keep their feet in both camps. So this idea of, I do think that middle school kids are the meanest kids on earth. It's like, oh, they're just so cruel to others. So, this idea of finding your group, finding your tribe where you can find people who are like you and whatever else. And I think it's really important for parents to keep those doors open, because by closing the door, basically saying, you will be typical, you will only do typical things, it's really kind of cruel, because for a lot of our kids, they don't feel like they were able to connect with typical kids, especially through middle school and high school. Some kids are, and if you can gravitate, I even have teachers identify nice kids in the classroom to do that. But it's hard for parents because you don't know. And in high school, a parent in the classroom is a weirdo, right? It's like, you don't want to be that person. So it's really important to let teachers and other people kind of help identify kids who might be potential friends for your kid.
Susan, can I also comment there? Because I think this is something that, parents worry about a huge amount and place a lot of responsibility on themselves in relation to, but actually I think it also relates to the policies within schools, so I think where schools are more inclusive and to maybe have more mentoring and buddy systems. It can be a good way to encourage, you know, if a child is in a more sort of mainstream setting where they have opportunities to mix with typically developing peers, maybe as well as atypical children who are atypical, that they, you know, that they do need to be supported and scaffolded around it. And I think the typically developing kids need to have some kind of training and awareness as well for that. So I think and maybe I know here, like, it's a parent audience and people want to know what they can do, but I also think it's maybe advocating within a school environment towards greater inclusivity and awareness.
That's a great idea.
I think that's a good idea. And then I would also play to their strengths, right? So in middle school and high school, they have interests. And we talked about how, you know, interests there are some interests that are more common for kids with PWS than others. So I would play to those and put them in situations and encourage them to join groups where they have interest in that area. That will help make connections with other children.
So we heard that Dr. Dimitropoulos, you are enrolling for some of your further research. Dr. Gallagher and Elizabeth Roof, are you guys looking to enroll more people in any of your studies?
Yes, we are. We're a little bit stalled at the moment. So a lot of our recruitment's happening online, and some of our testing that needs more in-person testing is stalled until 2021.
Sure.
Yeah.
Do you have any virtual participation opportunities, or are yours all requiring in-person?
No, we are also recruiting virtually. Yeah, so we're doing a lot of the behavioural evaluation virtually. Yeah.
So will that study require future in-person, or can someone participate 100% virtually for your studies?
Well, really for the eye tracking and the EEG, that cannot be done. So those aspects of the research, you know, would be difficult for people to participate in. So it wouldn't be possible. We have to have them in the lab.
Right. Okay.
So it would just be kind of half the research they'd be participating in. So at the moment, we're kind of prioritizing people who can come into the lab because that's what the focus of our research question is.
Absolutely. And Elizabeth, do you have any social groups that people could get on a list for, or any research that people could participate in?
So we're doing several clinical trials, but right now we're not the BOSS groups have ended and we're getting ready to publish the curriculum. So it'll be something that will be out and people can access. We're literally waiting for an editor to review it so that we can kind of get started. But my thought is the social groups we're thinking about running once a week. So under 18, over 18 is kind of what we'll do. And we have a new research assistant named Charlie McDonald who will actually be running those with some rules, again, some idea that we can actually connect people up. And so those will be on the Vanderbilt Facebook page probably in the next week or two. He just started. I can't exactly go, okay, Charlie, now you're on your own. Enjoy but it's a lot to manage. And so we're hoping to have those. But research-wise, we're not seeing people, only because right now all we're doing is kind of running trials.
Okay. You know, we hear that people with PWS are at greater risk for autism, but how many people with PWS actually have autism versus just some quirky PWS behaviors?
So we found about 12% of our sample had autism, truly had autism. There were like another 25 to 30% that definitely had a lot of the features of autism, but didn't meet criteria. So I think you're right. I mean, there's that quirky feature, and autism spectrum disorder is a spectrum disorder. And I think PWS is similar in that way, that some kids have more of one thing or less of another. And I do think if they have autism, have that true diagnosis, that some of the PWS features are kind of eclipsed, like by autism. So less food seeking, less some of the other issues. But what you find, like you said, is that getting that diagnosis is really helpful because it gives you access to other services that you may find very helpful to deal with some of the autism diagnoses.
And if parents are looking for social outlets for their kids, I know local resources vary from region to region, but what are we looking for if we want to get our kids out? What's your advice to parents? No one wants to take that one.
I'll say a few things, and this is, people are also asking, whether, like, how old is too old for ABA, and, you know, in particular about adolescents. And I think if you find an ABA therapist who has experience working with adolescents and is also willing to be flexible to consider the unique aspects of PWS, the ABA can be helpful for adolescents as well, depending on what you're focusing on. So I wouldn't say they're too old for ABA. Regarding social outlets, you know, in the pandemic, there's nothing, but sadly, but, you know, not in a pandemic. I mean, my daughter has gotten involved in several different activities through the Parks and Rec department. They have kind of social groups and outings and things like that have been really enjoyable. There are some church or religious organizations that have activities together. Nowadays, all those things are online, which a lot of kids are doing. And although it's not the same as in person, I think it can be really helpful. And for younger kids, I know in our area, and I think this might be national, there was something called Wally's Club, which was a social skills group for kids with social skills challenges. It was kind of a variety of children, and they met after school. And that was a really helpful thing when my daughter was younger as well.
I don't know, do children do in the US, there's a lot of involvement in Special Olympics. I know that's really big in Ireland, and a lot of kids with neurodevelopmental disabilities participate in, you know, different kinds of activities within that context.
That's definitely a great one. It's right now is virtual and not in person, but I agree that Special Olympics, Girl Scouts, Boy Scouts, it really doesn't matter, sports teams, anything that enforces compliance and cooperation. So basically turn taking, anything that makes kids kind of have to be part of a group and have to kind of comply to get along is something that's going to be helpful. And I think Anastasia's right. You focus on their strengths and interests. So, you know, if your kid's not musical, you don't go to like violin lessons. Maybe you come up with something that's more related to what they'd like to do. And a lot of kids are very interested in pets. So we have several teens and adults who volunteer at humane societies. They're kitten socializers, they're whatever. They find a thing that they really enjoy doing. And that is a connection socially, because if you're in those groups, there are 2 or 3 kids sitting in, you know, like a room with kittens or dogs or whatever else. That gives you a whole new friend network, because you have a common interest and a common goal. Just like with us, we have to find people that have the same kinds of interest and goals. There's no difference. You just have to be creative. So you want to make sure that no one is serving, you know, snacks at every, you know, group meeting. And if they are, you're kind of managing those kinds of things. So you have to kind of think of some of the PWS specific issues, but those things are all great ways for people to get socialized.
You know, another avenue as well is our kids do tend to like music. So, you know, joining choir, especially through school, or singing groups, and acting. I mean, sometimes drama classes, if the teacher is open to and appreciative of your child's quirkiness and inclusive, you know, that can go really well for some of our kids too.
And that's another way to learn social skills, being someone else. We did a lot of role playing where kids would actually be us. Somebody would be me and somebody would be Haley. They absolutely loved that part. Somehow I was very, very angry and loud. I was like, I'm not Jerry Springer here, you know, but I loved the fact that they completely loved being us, because it gave them opportunity to be somebody else. And I think we've had several folks who've been in plays and who've been amazing because they get to be somebody else. How cool is that? Talk about the ultimate perspective taking.
I'd like to thank all of you for joining us today. It's really been great to be able to hear some of your perspectives and things that you have learned in your research. You know, just a note to our audience, you've heard about a lot of amazing research projects that these amazing individuals are working on right now. A lot of these have been funded by FPWR, and we want to thank our community for making that possible. We need your help to ensure that research like this keeps going at an accelerated rate. So if you were so inclined, we would love to have your support this year as we round out 2020. And finally, we hope that you will come back and attend another couple of sessions this week. We have 8 or 7 more sessions. Our next sessions will be orthopedics with Dr. Van Bossi, as well as a grandparents session just for our special grandparents and other relatives. And finally, today at 3 o'clock, we'll be having a presentation from Soleno Therapeutics. They will be reviewing the results of their DCCR study. So hope to see you later today. Have a great rest of your day.